President Obama went to Annandale, Virginia to pitch his public health care plan, and the health care plan, of course, has a public option, and he actually lobbied for it a little bit in the meeting, and I thought that was positive. At least he's pushing for it, and that's a good sign. And then he was going to take a question from the audience, and he did, from Debbie Smith of Appalachia, Virginia, and it became a little emotional, and we want to share that with you. Here's the president at his town hall meeting.
Good afternoon, Mr. President. I'll try not to cry. I'm trying to figure out what I can do currently. My situation is I had renal cell carcinoma in '98 that was radiated because my dad was dying of colon cancer at the time, and I was his health care surrogate on his living will. So I could not be tied up having my kidney removed. So they did radiation procedures to kill the tumor then, and I had insurance and everything was paid for that. But basically, because of the damage that the radiation did and things, I'm no longer able to work, and I have no health insurance. Now I have a new tumor. I have no way to pay for it. Doctors will not see you without paying $100 or $150 to get into their office. I can get checked into a hospital, and under their engineer program, they will run tests and release me, but that costs a lot of money. So currently, I basically... Social Security will not give me disability because renal failure is no longer a qualifying factor under Social Security currently. I cannot get Medicaid in the state of Virginia because you have to be qualified. You have to be considered disabled through Social Security to qualify for Medicaid in the state of Virginia because I have no dependent children at home. It's just me. I get food stamps, but that's it. And I'm just trying to figure out how I'm going to make it 9 years till I'm qualified to get my regular Social Security. Now that I have a new tumor and have nowhere to treat it.
Well, here, come on over here. First of all, we're going to find out what we'll get your information and we'll see what we can do to help you. I don't want you to feel all like you're alone on this. Without knowing all the details, I'm not going to give you an answer right now about exactly how we can help. We're going to find out what we can do within existing law. But what was your name again?
My name is Debbie.
Debbie. Debbie is a perfect example of somebody who we should, in a country this wealthy, be able to provide coverage for her health care problems. And what we don't want is a situation where Debbie gets worse and worse because she's not getting treatment and then ends up having to go to the emergency room. As I said before, all of you will pay for it anyway. It's just you'll pay for it in terms of a hidden subsidy, and she's not getting the best care, and we're actually paying more than we would have if Debbie right now was getting treated on a regular basis by a physician who knew her history. So, Debbie, you are Exhibit A, and we appreciate you sharing your story. We are going to try to find ways to help you immediately, but the long-term problem here is going to be how do we create a system in which Debbie's getting the preventive care that she needs and is able to get regular checkups, is able to get treatment in a way that is much more cost efficient than the one that we've got right now. And I'm going to make a commitment that we're going to get that done this year. All right?
All right, first off, as far as stagecraft is concerned, the guy's great at politics, man. I mean, when he goes to hug her, that's a winning moment. And if you say, I don't give a damn that he hugged her, I care about his policies, I agree with you, okay? I don't want you to be misled. I'm just telling you on the political end, the guy's really good. He knows what he's doing. And, how would Bush have handled that? He's like, sorry, I wish I had a magic wand that said, cancer, go away. But I don't. Like if he would have made a fool of himself, generally speaking. Although Bush had some degree of empathy in a crowd, and he knew how to work a crowd a little bit. I mean, I'm probably giving him too much credit here. But the guy who was great at that, of course, is Bill Clinton. But Obama knows how to do this. Now let's go to the policy end. Look, I really empathize with Debbie there. We're all in the same boat, man. This week, I had to grapple with, they talk about bureaucracy, how the public option would have bureaucracy. Has anybody had private insurance in their lives? Does these guys ever have to pay their bills by themselves, or do they have their butlers paid? I don't know what it is. But I had a simple set of checkups, blood tests done, right? I got a bill from my doctor. I got a bill from Specialty Laboratories. I don't even know who they are, but apparently they were sent. They said, oh, no. And then you call them. And they say, oh, we didn't know you were Blue Shield. We thought you were Blue Cross. And then the doctor says, oh, well, they charged you initially as an HMO, but it should be a PPO. And the bureaucracy is endless. It takes hours to wade through it. And something that was supposed to be an $80 bill winds up being a $200 bill. So you're talking about bureaucracy? Look, and the second thing, and why Debbie's case is so important there is, you know, I often on the show talk about how the public option is going to be cheaper. And I need something that's cheaper. Insurance is killing us. It's killing us in terms of cost. But the other aspect of it is what Debbie's talking about. Look, you want to know that you're covered. I mean, wouldn't it be nice to have an option? And I'm not saying the public option is going to be magical, right? But I want it as an option. I want to try it. And who knows, maybe they screwed up. Maybe, and there's a lot of devils in the details. Maybe it doesn't work right. But I'd love to at least give it a shot and have an option where I can go and say, yeah, you know what? I'm not going to get dropped because of a pre-existing condition. They're not going to do this trick that the private insurance does, that once you get sick, they literally do this. We had an expert on the show talking about it. In fact, they went in front of Congress, and the insurance industry had said, no, we're going to keep doing this. As soon as you get a major disease, they assign someone to your case to try to find a way to drop you from insurance because you're going to add to their costs. Now, if you're running a capitalistic, company, which of course all these private insurance guys are, you want to lower your costs. So you have a market incentive to drop people as soon as they get sick. Now, wouldn't it be nice if we had a public option where we're not incentivized to drop you when you get sick, but to actually take care of you when you get sick? I mean, I think that's worth trying. So, one, it would cover everybody, and that would be just an enormous relief. Two, it appears by all estimates, and what the private insurance is really worried about, it would be cheaper. And three, I actually think there'd be less bureaucracy, because then you wouldn't have the HMO and the PPO and the which doctor covers this and which laboratory covers that. You'd have one plan, you go to it, and you have exactly know what's covered and what's not covered. Doesn't mean everything's going to be covered. It's not going to be Shangri-La, but at least you know exactly what you're getting.